The last couple episodes, I have talked about why I no longer refer to obstetrics and gynecology as women's health. And I included a challenge a couple episodes ago for others to think of ways they could be more inclusive in their language around healthcare, that they notice their gendered language, how to be more inclusive. And I have received a lot of feedback and comments from that, which is not terribly surprising. So I want to spend today talking about some of the comments I've received because I don't think the people that commented are alone on their feelings. And I think there's a lot we can learn by looking at it and discussing it. Because maybe you have had some of similar feelings. Like it would not surprise me if people that desire to be gender inclusive may still feel uncomfortable at the idea of taking away women's health in reference to obstetrics and gynecology. And if you're one of those people that desire to be gender inclusive, but felt a little tentative, a little uncomfortable with the concept, it doesn't make you a bad person. It doesn't make you any less of an advocate for gender inclusivity. You're here, you're listening, you're examining, you are deciding on understanding what about it is not gender inclusive and how you want to practice. So, this episode is for you, and especially if you're a healthcare provider that has some hesitation about changing their language, not quite so sure about it, this episode is for you. So, one of the comments that I received about not calling obstetrics and gynecology women's health, it was that I wasn't being sensitive to women, specifically cisgender women. That's not how they identify themselves, but that's what they were referring to. That I was not being sensitive, that they felt I was erasing them in a desire to help other people. I want to talk about this a little bit because the idea is that by being inclusive, by using terminology that is accurate for our entire audience, that using terminology that incorporates everybody that we treat will somehow erase a subset of individuals, a majority of our patients. And so the way I like to think about it is I'm a very proud woman. I'm proud to be a woman. I'm proud to identify in that way. And I don't personally feel if I'm addressed in an audience that may have more genders than myself, or even if everyone identifies the way I do, however, the audience is welcomed to be anybody, that people refer to me as part of a larger group, as a guest or esteemed member or anything like that. That's a general term. And I liken it to like if I'm in an audience that's at a healthcare conference or grand rounds or something where there may be more than just physicians in the audience. There may be nurses and there may be physical therapists, occupational therapists, social workers, pharmacists, other helping professions in the audience. If the speaker addresses us as healthcare providers, I don't stop and think, wait a second, why didn't you say physicians? Why didn't you identify us? We're the majority here. Why don't you say physician? No, I don't get upset by it because the term they used, healthcare providers, includes who I am in that audience as well as it includes everybody else in that audience. That's all that we're doing. We're not erasing, it doesn't erase someone to use a more general term that encompasses everybody. Because here's the thing, we are talking about addressing everybody. Who do we help? That's what we're talking about. But if we're talking to an individual person and they identify as a woman, then I'm going to absolutely use the term woman in reference to that patient. Nobody is erasing who somebody is. We are just talking about it is the difference between speaking to an individual or speaking to a small group where you know how each person identifies versus addressing a bigger audience or addressing and welcoming people so that they know that they are included in your audience, or in this case, in your care. The second comment I got, and I'm going to paraphrase because I don't really want to quote the exact words, but something to the effect of, why are we going to change for a small group of people? And this is a common question. Why are we going to change? Most of the patients are women. What is the issue here? And I think it comes down to values. As we've discussed, that using the term women can lose some of your audience in that terminology because they aren't seen. Think of an incident where you have been in an audience or you have been receiving the message, someone's speaking to you in a group. And maybe you are not the majority in the group, whether that's based on your gender or your faith or your heritage, like anything. Think of something where people make comments to address the audience, but whatever terminology they use does not include you. And for me, my experience has typically been for my gender, where people have discussed and referred to an audience I've been in as gentlemen. Gentlemen, da 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 da. And this is an audience that I know I've earned my spot at the table. I am meant to be there. I am supposed to be there. And yet, even though I may be the only one that identifies as a woman in that audience, when somebody addressed the audience as gentlemen and I'm sitting there, then I feel erased. I feel erased. Then I start to question, what is their expectation of who's supposed to be sitting in the audience? Do they not expect someone other than a gentleman to be in this audience? And if that's so, how am I going to be treated? Will I be treated the same as everybody else? I don't think that experience is much different for anyone that's going to walk into a space that is not using language that addresses them. So, yes, it may be a minority, but as healthcare providers, as physicians, do we really want our patients coming in questioning whether we're going to treat them the same? Questioning whether we expect them to be there and will we be able to provide the care they need? This is the problem with not using inclusive language. We see it play out because there are reports of many people who are transgender and non binary who do not seek medical care because of negative experiences, do not seek medical care because they think that the providers aren't going to treat them well, do not demonstrate the understanding of gender, the difference between sex and gender. And that's what's happening when we use language like women to discuss biological organ system. That is further played out in other ways. Currently, I'm part of a federally funded committee that is doing work on cancer disparities among transgender and non binary patients. And our committee is made up of healthcare providers, researchers, and community members. And when we were talking about specifically about cancers that have a tendency to be referred to as gendered cancers, so we tend to use gender language with the cancers like prostate cancer, breast cancer, cervical cancer, etc. How that creates a barrier for people that have those cancers, that have those organs that need care, whether that's preventative measures or whether that's treatment for diagnosed cancer. That by using gendered language, we're making it harder for people to seek care. And it was interesting because many of us having that conversation were not transgender or non binary. And those in the committee that were delighted and shocked that there was even that awareness of that experience, which makes me sad. They did not expect healthcare providers to have that level of understanding. And I believe we can. I believe some of us do. And that's where language becomes important to be inclusive, to show our understanding. And I just want to point out that this doesn't just affect what I'm talking about here with the cancers, does not just affect transgender non binary patients. That's our focus for that committee. But as a healthcare providers, many of you know are a small subset of cisgender men who develop breast cancer. They face some of the same challenges because of using gendered language for a biological system and process. The last comment I want to address was not a negative one. The last comment I want to address is somebody thanked me for presenting it, that they were not an obstetrician gynecologist. However, they found the conversation very useful in their own consideration in their own life of how to be more inclusive with the people around them. And this makes sense to me. It is not surprising that if we're referring to obstetrics and gynecology as women's health, that society begins to think of all of those functions as gendered functions rather than what they are, biology. So the way this plays out many times is when groups are together. I'm in this example thinking of when they're a group of people that identify as women. Sometimes people talk about having children. It's all on us. We have to have children and take care of the family and do our work and do this and that. We have to have children or something along those lines, right? And there's so many times where I've witnessed conversations like this with the assumption that first, everyone in there that identifies as a woman wants to have children, which isn't always the case. And the second assumption is that they can have children, which isn't always the case. And I don't think I've been in a place with this conversation where somewhere I noticed the body language of somebody changing because it is not in reference to them for one of those two reasons. And it further creates pain. And I think many of us that have helped patients who, whether we directly help the issue of infertility, but we've had patients with infertility, how painful of a process it is, and how, for some, and in the sense of the attachment we put with that physiology to identity makes many of them question their womanness, quote unquote, their womanhood, quote unquote, if they can't have children, or even if they don't want to have children. How does society view them? And I think we play a role in this pain by perpetuating the idea that these physiologies are related to the identity of gender. So I think we can do a great service by being the example of beginning to separate those things. And one of the way to separate gender from biology is to stop referring to biological processes in a gendered way. Stop referring to obstetrics and gynecology, which has a greater audience than just women. Stop referring to it as women's health, because that will be more inclusive to all people. And on top of it, it demonstrates an understanding of the difference between biology and gender. It also takes away those expectations that often come with language. What are you expecting of me if that's the language you use? You begin to see your patients as they are. Let them share with you who they are. Let them share with you what it means to be a woman, if that's how they identify. Let them share with you their relationship with their bodies, regardless of how they identify. This is the freedom of beginning to separate gender from biology. This is the freedom of being more inclusive. It's empowering the patients to share with us who they are. People may have a very valid reason to be concerned or even scared to take away that title, because many people who identify as women have had to fight for their seat at the table. And so when something feels like ours, this is women's health, it's ours, we can be protective of that. And it makes sense. But I would offer we're protecting the wrong thing. What makes a person, a woman, if that's how you identify, has nothing to do with your biology. And if you do identify yourself with your biology, that's okay. It's your right. You can, but that's your definition. It's not everybody's definition. And that's when it comes back to the idea of inclusion is who is our audience? Who are we talking to? When we say women's health, we're trying to talk to all our patients, which is inaccurate and not inclusive. When we are speaking to an individual person, then absolutely use the language they use for themselves. And when we open that door to be inclusive, then we allow people to tell us who they are. And that's why inclusion matters.